A pleasant welcome to today's edition of the program Our Health. This is a 30-minute television program that makes you to understand the holistic healthcare. It gives you better understanding of comprehensive, basic, healthy living, and we also show lights on sounds and symptoms, how to prevent common diseases. So today's edition will be basically looking at cancer. We'll be going in depth, and today we'll have our guest in studio. So we'll take a short break, and then we'll be joined by our guest.
Did you know that every minute of your life counts? Did you know about 90% of our people are ignorant about issues concerning their health? Join the program, Our Health, for better understanding of holistic healthcare, prevention and management, understanding the comprehensive basis of healthy living, knowing national policies on safe health, how to use the available resources at the sporting times of sudden illness, promoting good healthy living habits, promoting good healthy living environment. Join our health talk live on Super TV, channel 10 with your host, Jarausi Joe.
Welcome back. So today we are in studio. Ladies, can you please introduce yourself for our audience?
I'm Patience Kapsliki, is the physician assistant and a popular specialist, social.
Wow. So like a few days, then calls on you. It's like, oh, I'm busy. I'm, I'm doing this. I'm doing this. Yeah. So how's the work? How's the work?
Yes, the work is good. It's just the brain, yes. Everyone is busy, but understanding when it comes to health education, it was make time for it. Okay? That's good.
So let's move in our topic for discussion. So basically, can you today we'll be discussing cancer like I previously said. So basically, can you tell us what is cancer?
The definition, we say cancer is a large group of diseases that can start from almost in an organ or tissues of the body where the abnormal cells or tissue grow uncontrollably. Yes, so that that cells grow uncontrollably or they spread the blood outside the body.
So cells that grow uncontrollably and disperse all part of the body. So that's the definition when it comes to cancer. So now we're looking at cancer. So let's look at our region, like in Liberia now. So you think that how what are the kinds of cancers that most likely form in this part of Africa, more especially?
So to name a few, we have a type of cancer, and those type of cancer, to name a few, like I said, we have breast cancer, we have colorectal cancer, we have skin cancer, we have cervical cancer, we have prostate cancer, um, and we have stomach cancer. So to just elaborate a little, if you look at these cancers that are just listed, in 2018, it was estimated that 9.6 million people worldwide died from this type of cancer. And then in 2020, you see breast cancer had like 2.2 million cases. Um, then the lung cancer had they had 2.2 million cases as well. Then colon cancer had like 1.9 million cases, just to name a few. So looking at cancer right now is spreading because if you go to health facilities right now, if you were to do your statistic, you notice that a lot of people are coming down with cancer. So this is something that I have to raise concerned, it has to come to uh, our leaders' knowledge. We need to see how best we can work hard to prevent cancer in our country or in other parts of the world.
Yeah, so like the percentage range that you are calling, it kind of making me scared a
Yes,
little bit.
actually, even myself,
Yeah.
it's alarming. Yes, but that's the statistic. If you see WHO, every now and then they review these things and they come up with new updates. So it's kind of scary to be frank. It's kind of scary. Yes.
So what are those things that cause this cancer disease?
Thank you very much. So, looking at the process of cancer, there are some things that we ourselves can do that will help us, that give us, we are perhaps high risk of getting cancer.
What is your lifestyle?
Yes, our lifestyle. So, the, just the name of few, we look at tobacco user, those who smoke, those who smoke tobacco, we see contaminated food. That's why a lot of time, even though there were even people who smoke, you will see they are not stopping you from smoking like you can see by yourself, but they will definitely tell you that tobacco or cigarette is dangerous to your health. So those are some of the reasons. But some of the food, some of the food we eat, how we prepare our food, that's why a lot of times we got to be careful the kind of food you buy in the supermarket, in the market, and how you store your food. So contaminated food can also cause cancer. So we also look at those who take in alcohol, those who drink alcohol beverages, those people they are also at high risk of getting
Is it just taking alcohol excessive?
whether excessive or not, because when you start alcohol, you start to drink alcohol or you start to smoke, whether the smoke, the tobacco is excessive or not, you know that it damages our health. You understand? To some extent, it damages our health. So once you are into alcohol and you are into smoking, you still at high risk of cancer.
So what about the food we eat? Does it play any part in us getting cancer or
Yeah, so like I said, I was talking about contaminated food.
no?
Yes, so contaminated food, yeah, that's why we have to be buying food from the supermarket, look at the expiration date, and where you store your food, make sure that the food is not contaminated, and then before consuming your food, because if you start to eat contaminated food, obviously you're going to get that. The radiation too, radiation, local radiation, and exposure to radiation will also come from the cancer. Then you have some diseases that can cause cancer. We look at some viruses, virus infection. For an example, we have the HPV virus, which is the human papillomavirus. We have the hepatitis B virus, and so the viruses can cause of cancer because some of the viruses don't have the viruses don't have Q or viruses don't have Q. So you label those viruses and protect those application all of those things. So that's why you see they have been vaccinating the girls because the HPV virus is responsible for cervical cancer. So we have been vaccinating our young girls against them so that they can come down with cervical cancer.
So looking at cancer, like other viruses that are genetically transferred, so can cancer come part of it too or
Cancer can be hereditary. It can also be hereditary. Yes, cancer can be hereditary. So when you have cancer, it's also possible that some of your family. So it can be hereditary.
so let's look at the range when it comes to people who are mostly affected when it comes to cancer. We look at the male and that of the female. Who let's say who stand the chances of getting cancer when it comes to getting
The
cancer.
ages varies. So it might not be exact, but the ages varies. So females, they are mostly down with cancer. Yes, they are mostly down with cancer. So the ages varies. Some people start at 50,
Mhm.
some people start at 42, some people start between um, uh, 20 to 39. So it varies.
So based on your age or based on your exposure
The
to
exposure.
a dangerous thing.
Yes, because even the possible people who smoke, if you smoke, depending on your lifestyle, all of these things, it's possible you can come down with cancer at any time because you still have high risk of getting cancer.
So now, like for you, you're in the medical field. So let's say you see most of these patients. So now, like in Liberia, like where we work, is there how percentage of people coming over for cancer cases?
No, I would say no because where I work is a health center. Um, so sometimes what happens is that because we don't have the facility of the instrument at my place of work, so if for any other reason that a patient visited your facility and then you suspect that the patient has cancer, then we do a referral. Yes, I have come across people like that, okay, where I work in the PR. On few occasions, I have come across people like that and I suspect and then refer them to other JFK or detention center because it's a referral center. So you refer them there for confirmation. You can tell them, look, based upon what you explained to me and what I've observed, I'm sending you to this hospital or referral center under JFK or detention so they can do a proper investigation on you and you know then they can come up with a diagnosis as to what you really have. Because you have to know that when the patient comes to you based upon your symptoms, the signs and symptoms, you're gonna do screening before you can come up with any diagnosis. So the patient comes to you to the facility and you take your history, then the patient will explain to you. So some signs and symptoms of cancer, we have bleeding and discharges, we have persistent cough, we have wound that was not healed, we have uh, we have, a lot of them, just a lot of signs and symptoms we have. So when the patients come with their symptoms, you look at the symptoms because, like I said, the symptoms or the signs and symptoms vary, according to the type of cancer you have. Okay, the type of cancer you have. So people will have seizure. A patient will have seizure if they have a brain cancer, and patients, female will start to bleed vaginally, if they have cervical cancer. There will be a lump or breast changes if a patient has breast cancer. You understand? So the symptoms, the signs and symptoms vary, when it comes to the type of cancer the patient has. So if a patient visited your facility and maybe they explain to you, these kind of symptoms. Also, we have weight loss, and weight changes, then we have irregularities of skin. The skin color will change. The color turn red, it turn yellow or jaundice, or it turn dark. So there are a lot of signs and symptoms you will see or the patient will present with that will give you a clue that, well, I think this is this. So let me send the patient to a referral hospital for confirmation. And sometimes you send them and the people can be positive.
Yeah. So sometimes we take these things uh lightly, like when you're experiencing these common sounds and symptoms like the represent and the coughing and other things. So I was actually coming to that sound and symptom, but then we came in.
Yeah,
So
no.
yeah. So what would you tell someone who experiencing these things? Because some people they experience it for a longer time, but then they don't really take it more
Seriously,
serious.
yeah, you are right. You are right. That's why, like, in the various facilities where we have the health centers, the hospitals, or what have you. So we do health education. So it depends on the facility you work in. Into like my facility, we have this everyday health education. So we speak on different topics. So it could be today, like today, it was actually raining, but one of my colleagues got malaria. So like tomorrow, once it is a working day, so other people will speak on diabetes, on hypertension. So this topic, when it comes out and you help educate your patients, they will know because sometimes some of them even have the symptoms, but they are afraid. They are afraid to explain it to people because one of the symptoms of cancer is that unexplained pain. You know, you have the pain that you just can't explain. That pain is there. You understand? And like you, they're having vaginal bleeding. You think that you are worried. Oh, my menstruation just ended. How come I'm not menstruating again? You start to think. And then you overlook it the first time. Maybe your family month is starting. You know, then after 2, 3 days, you see, you have to use pad. Then the next day they subside and then another time they came home. So it's time to ask yourself, look, I don't think this is normal. That's not how my nurses were coming. So I think I need to visit the hospital and talk to someone. You understand? So now every time you hear health education, if you are speaking on a particular topic, you stress on those things. Try to elaborate on the signs and symptoms, of it. So that when any of them having to come down with those things, they will immediately rush to the health facility and explain to the caregiver. Then you can help them. And for either referring them, or if your facilities can do those tests and treatment, then you do that.
Wow, so it's really educating. So we'll take a short break and then we'll come back. We'll explain more because actually I'm actually learning a lot. Yeah, I'm actually learning a lot. So like the way I'm learning, I hope all of our viewers are also learning too. So we'll take a short break. When we come back, then we'll explain a lot about this cancer issue.
Did you know that every minute of your life counts? Did you know about 90% of our people are ignorant about issues concerning their health? Join the program, Our Health, for better understanding of holistic healthcare, prevention and management, understanding the comprehensive basis of healthy living, knowing national policies on safe health, how to use the available resources at a spot times of sudden illness, promoting good healthy living habits, promoting good healthy living environment. Join our health talk live on Super TV, channel 10 with your host, Jarausi Joe.
All right, so then welcome back. So welcome back. So we'll continue our topic on discussion. So thank you for keep listening to us, keep following us as we bring you the best preventive measures when it comes to our health issues. So let's come back to our discussion. So now let like what you were saying previously, giving health education to your facility. So what becomes of those that are in the rural setting who don't have the opportunity like for those that are in the city region. So how you will manage to reach out to them to give them that information that will help them too.
Thank you very much. So, yes, right now, like we have, it's not like before where we never had a lot of facilities in the rural area. Now, the government have made it possible to build a lot of government health centers in the rural area. Like a few years back, I was working in Maryland, Harper district. I was in Harper district where I was officer in charge of a particular clinic. And our clinic was so far from Harper itself. So, there's still people used to leave from the villages and come to that facility to get help and, to take their medications and other things. So, there are a lot of health facilities in the rural area, and our colleagues are there, they have education and all of those things. And it's also good that you guys from the radio station, you are taking up your time to develop such program, which is very, very good. And so, trust me, most of the conditions we are discussing, our people here are hearing it. If for any other reason that someone is far off in their library, it is so disheartening to know. But there are health facilities almost all over the country, and people are learning from that on a daily basis because once upon a time, I refer patients to Tapata Hospital. And so just imagine Tapata Hospital is in my country and it is there and people are accessing it. They come from the villages and visit that hospital. So that's a good thing that the doctor is doing, to make available a lot of health facilities so that people can access the health facility and come up with their problems, so that they can be effective.
So now, how can I prevent myself from coming down with cancer or getting in contact with cancer?
Oh, okay. So now we are looking at the causes.
Mm-hmm.
So these causes, obviously, you need to prevent them. So let's look at tobacco use. So if you are told that if you are smoking, you still a high risk of getting cancer. So then avoid it. You avoid smoking, you avoid drinking, okay, and you avoid eating contaminated food. Then for those STRs, like the viruses we talk about, the human papillomavirus, which is the HPV, the hepatitis B, all of those things. We try to live within our group so that we can come down with those infections. Sometimes, although we know that when it comes to infection, sometimes we get it knowing it and unknowing it. Yes, but you can try your best so that you can prevent yourself from being at high risk. Okay? But if for any other reason that you came down with such a problem or you are experiencing, you're having symptoms of those problems, then please visit a health facility. Ask your caregiver, ask for help, and they will be able to help you. If they cannot help at the level, they will be able to refer you.
So, how can I manage living with cancer disease? Or how can I manage living with cancer disease once you get in contact with it? How can you manage living with it?
That's a very good question. That's a very, very good question. So now, managing cancer, let's look at first how you can diagnose cancer. Okay? How to diagnose cancer. Because if you properly do your screening and you do a correct diagnosis, then treatment can be, it can be much more easier. And that will help to prolong the person's life. You understand? But where if the person has cancer and then maybe during your screening you notice that the cancer has reached to an advanced stage, you understand, then it will become difficult for treatment. You understand? So you can manage cancer if you have an early diagnosis and then early treatment, then you start to manage cancer, which is going to prolong your life. But when if you come at an advanced stage, then you have to start looking at your social, your mental, your spiritual aspect of life and see how best you can have people to talk to you to be able to cope with it.
So, like the HIV virus, where currently people are living with, and let's say the more you take your medication, you can live for a longer period. Is it?
That's right. Yeah. So it extend your lifespan if the virus if you have early detection of the virus and you start your treatment. So that treatment is going to give you a long lifespan. Also, you already in your last stage or in your terminal stage. If you coming, it becomes difficult for the health worker to actually do their best. Yes, to actually do their best.
So let's look at baby's mama. So when when a baby mama comes out with cancer, hmm, or when we having a child and she comes out with cancer, you people separate the child from the mother, or the child can still be with the mother.
His child will be with the mother. because they are not 100% improving health. If a mother has cancer, then it means that you have to separate the mother from the baby. No,
But you said previously that it's already true.
yes, but it's rare with that as the child is growing up, but you cannot separate the mother. So almost like even if I have HIV or you have HIV, with this separate, separating maybe meaning taking the child away from the mother. No, you can't do that. All you need to do is that you can educate the mother on what to do with all of child live with the mother. There are people who have HIV, there are people who have cancer and the children are still living with them, they're taking care of the children, and giving them the best education and all of they are of good status, of good standard, all of them. Yeah, so you cannot separate the mother from the child. Because they'll be doing more harm than doing good.
So like the HIV virus. Hmm? The reason I'm looking at the HIV virus and the other cancer because people have understand the HIV virus as compared to the cancer virus. So like HIV virus transferred sexually, right?
Mhm.
Yeah. So
So many means, not only sexually, but so many means. Blood transfusion, sexually.
so what about the cancer too? Is it the same
No, it's
thing?
not. Cancer is not sexually transmitted. So if you have your wife who has cancer, that will not stop you from sleeping with her. To say, oh, because she has cancer, so I'm afraid maybe I'm with cancer. It's not sexually transmitted. It's not part of the sexually transmitted.
So it's communicated?
Cancer cannot be this cannot be compared to say you have cancer, so hypertension. No, you cannot get cancer with hypertension. Yes. So like if we're looking at the if we want to look at some management of cancer, like you want to see the treatment of cancer, so going back to your other question you asked, you're going to be saying based upon the type of cancer that you manage, because not all the cancer have the same regimen, treatment regimen. So some will be by surgical means, some will be chemotherapy, some will be by radiation, and all of these things. So you gotta look at the type of cancer. That's why a proper screening, proper diagnosis is very much important so that we give you a clue as to which type of cancer is this and which treatment will be to the patient to be effective.
So let's look at what is that for those that are working in this medical area or those that are doing high level job, they also come down cancer.
No, it's rare. It's rare to say you're working for Singapore, you do have labor job, so you come down with cancer. It's rare. It's not something we could do. It's rare. Yes. So if you look at the process of cancer in this first, yes, you just follow the trend and see how one can get cancer. Mm.
So today has been so much fascinating. This discussion is very I don't know, it's very enjoyable and I've learned a lot and I think I need to start, using these preventive measures, like she regularly said, for me to not come in contact with this technique, cancer, disease, and I hope each and every one of you are learning too to be able to practicalize what she's saying because it's not by hearing it but by doing it, right? So once you start doing it, once you start abstaining yourself from these factors that can cause cancer, you will definitely not come down with any cancer disease. So thank you so much for accepting our invitation today to be able to explain.
Just to make my person feel because I didn't want to, oh, we calling her, she doesn't want to come. But actually, it was good being with you guys, and you are always welcome. You can invite me. The only thing, just leave time here and let me know
Yeah,
how we are available.
sure. I think my viewers will be happy that you come over for another segment because
Yes.
they have learned a lot. So I want to say big thank you to our producer and our partners for their support in this program. And we pray and hope that we will be able to extend this program in the rural sector too as well. So many thanks to our partner, and we are open to anyone who want to sponsor this program and partner with us as well. So big thank you to our producer, Elder Smith, who is behind the camera. We want to thank you so much, and the chief producer who is not here today, Levin Modan. And once again, I'm Jurassic Asia Prince Joe. Thank you so much.
Thank you.
Did you know that every minute of your life counts? Did you know about 90% of our people are ignorant about issues concerning their health? Join the program, Our Health, for better understanding on holistic healthcare, prevention and management, understanding the comprehensive basis of healthy living, knowing national policies on safe health, how to use the available resources at a spot in times of sudden illness, promoting good healthy living habits, promoting good healthy living environment. Join our Health Talk live on Super TV, Channel 10 with your host, Jurassic Joe.